basically, this is our December um, webinar for weight loss surgery with Mexico Bariatric Center. To enter our $2,000 off raffle, you need to have a health questionnaire in our system. If you have not submitted one, please go ahead and do. If you do have one, you don't have to worry. This raffle is with Dr. Alejandro Gutierrez. We would have the raffle at the end, so just listen to our presentation because we try to cover as many commonly asked questions during our presentation. And if you didn't hear it, you can ask us at the end. A little bit about myself. My name is Ron Elli. I am the founder and CEO of Mexico Bariatric Center. And I've been involved in medical tourism industry in Mexico from 2007. I started a project, Hospital Ozar, in 21. We opened the hospital in 2024, and we just passed 1 year. Hospital has given us huge success and has been given us the capability of basically starting new services. Like, for example, we just started doing Botox, filler, skincare. We've been, of course, offering all the new procedures in bariatrics and cosmetics. Dr. Gutierrez is with me. He will be covering all the procedures, including SASE and transit by partition. We've been doing gynecology like hysterectomy, endometriosis, and something that we call hybrid procedures we can offer. For example, we can do a gastric sleeve and hysterectomy at the same time in the same procedure. These are huge um, accomplishment because of the expertise we have, because of the hospital we have. We can offer these hybrid procedures. Of course, we started doing orthopedic, knee and hip replacement, and exciting new services like stem cell for anti-aging, knee, back, and rejuvenation. So, of course, you always get leading, top rated and latest news in the weight loss industry, whether it's bariatrics or weight loss in general. The articles we put in on Mexico Bariatric Center, yeah, is always a place to go check to see what is the latest and greatest. As I mentioned, we just passed 1 year anniversary. Again, one of the other new stuff we've been doing is the group travel packages. We started this with New Zealand and Australians. And of course, we could do this pretty much anywhere that we see a need for it. There is benefits of our travel packages because, of course, we could do direct flights, either is in LAX or San Diego. We have, of course, all the transportation that we have in our packages. And beside that, you get extra nights after surgery. Um, um, uh, I'm sorry, at the beginning, I had my microphone on mute. But anyway, so you get more nights. You get a tour guide with you, which is our past patient. Um, so there is so much benefit of that. If you're interested, you can email groups@mexicobariatriccenter.com. Um, actually, me and Dr. Gutierrez and I were in New Zealand. Very nice trip. That was my first time, and I'm sure Dr. Gutierrez's first time. We visited three locations in New Zealand, in the North Island and South Island. Very interesting country. It was a pleasure to meet all of our patients, past patients, future patients. It was a huge success. Um, and the seminars is something that we've been doing since 2005. I remember that was the first time we went to Houston, Texas, and it was very successful. Once we hit COVID is when we stopped doing seminars for obvious reason. And after that, we just basically continued with webinars. But that doesn't mean that we are not willing to go or we don't want to go. We love to go see cities. We love to go see our patients, our past patients, our people who are interested and they have questions. Of course, we always take one of our surgeons. This time happened to be Dr. Gutierrez, and yeah, so it was great. We had we had great success with that. Today, the topics I'm going to cover is basically obesity and its risks, how to calculate your ideal weight, and what is your ideal weight or goal weight. Um, Then we talk about what is the solution, what's the best solution to have weight loss, permanent weight loss, sustainable weight loss, and rapid weight loss, which is weight loss surgery or bariatric surgery, how it resets your metabolic system, and that's a difference. And we would talk about Dr. Hospital Ozar, which is what I mentioned is our new hospital. And we talk about we talk about the reasons you choose MBC, why MBC, and Dr. Gutierrez would talk about all of our laparoscopic, endoscopic, all different procedures we offer, including the new ones. And we will talk about financing a little bit and our nutritional program. And then we would do the question and answer Q&A, and we do the raffle. We all know what obesity is. And in the medical field, there is a formula, very simple, not very, I would say, precise, but it just gives you an idea of where you're standing in this chart. You basically put your height and weight. There's a calculator on our website. There are a million calculators out there. You basically enter your height and weight, and it gives you a number. And that number determines where you're standing in this chart. And as you see, it can go to super, super morbidly obese. And I have, you can continue this because we have patients that come to us with a BMI of 85. We've done a BMI of 91, 100, even 110 in our center. So there is no limit of what BMI we can handle, but in general, that's the chart that after BMI of 30, you pretty much qualified to get the weight loss surgery. Of course, some occasions we can do 28. Of course, with the endoscopic procedures, you can do 28, 29, 30. So we have solutions for pretty much everybody. And Dr. Gutierrez is going to cover that. So aside from the BMI, there is a way to find what your ideal weight or goal weight should be or is. So you see a chart on the right of the screen, and that shows based on being a male or a female, based on the frame size, we all have different bone, different shapes. And so let's say if I am a female with 5'4", with a medium frame size, I should be weighing around 120 pounds. Of course, we always go with inch and pounds. And actually, when we were in New Zealand, we had to convert all this to kilogram and centimeter. And so, but this is basically just the gist of it, right? In a certain height and a frame size based on being male or female, you have an ideal weight. Now, let's say if this person weighed 220, that means they have 100 pounds over. And when you see in the literature, they're talking about percent excess weight, basically they're talking about that 100 pounds extra for where you're supposed to be. And we will see, for example, for gastric sleeve, how much is the average. We're not talking about individual. We're talking about average, about 75% of your excess weight loss you lose. So you lose about 75 pounds or 70 pounds, and you will end up with 150. Now, this is average. We see patients that weigh 340 pounds and we go all the way to 160, or because even with gastric sleeve, right? So it's really the tool that you acquire, and we will talk about that, right? And what do you do with that tool? And of course, there are other factors like lifestyle changes you make. The age also is a factor. In general, basically, what happens is when we gain weight is our fat tissues or adipose tissues change its chemistry. The structural changes that happens, as you see from a lean person to a obese person, the adipose tissue or fat cells are different, and that is causing all the problems with insulin resistance, leptin resistance. That's why we don't, basically, diabetes type 2, we don't feel satisfied and full. Basically, you can look at leptin hormone like is a stop and start hormone. Ghrelin hormone makes you hungry, and leptin hormone tells you to stop eating. So you become insensitive to that. And you're not responding to therapies as well, the vaccination, and even your muscles don't respond to protein and exercise. We have actually articles about all these on our website, and you see how the muscles behave like you behave when you age. You don't respond to protein and exercise. This happens when you gain weight. So, of course, the causes we all know, right? The sugary drinks, ultra-processed food, lack of physical activity, comfort eating, stress. We go home, we're tired, we eat. not getting enough sleep, and we are used to large meals. Major risk factors comes in US alone. Of course, I know we have patients from Canada, from New Zealand, from everywhere. We have an international footprint. MBC has patients all over the world. And the US alone, 40% of adults are affected by obesity. Heart disease problem, diabetes, like I mentioned, lung disease. And during COVID, we found out that we need to lose weight or we're going to end up in hospital. There's more chance of catching the COVID virus, more chance of ending up in the hospital, more chance of fatality. So this is because there are more fat cells, so coronavirus can attach itself to it. Now, the question has been, how do we get rid of obesity? Okay, diet, exercise is great. We always need to eat clean. We always need to have a good diet, nutritional diet, and exercise being from just simple walking 30 minutes every day to being in the gym and exercising. But for obesity, this is not a proven long-term solution. And you're going to see why in a minute. And then now you have magic pills, which is actually not pills yet, it's magic injections. Ozempic, Mounjaro, these new group of medications that are a breakthrough, but still is not a long-term solution. You have to keep taking them. And we don't know what the long-term effect is. So still at this time, bariatric is a gold standard for quick, safe, and long-term weight loss. This is a way to explain why diet and exercise, to show why diet and exercise doesn't work, and this is how you explain it. Our metabolic system. Our metabolic system is something that our brain and our gut hormones and hormones in general operate around. So if I'm at 250 pounds, my brain and my hormones are used to operate around that set point or metabolic system set point. And when I go on diet and exercise, because my brain wants to bring me back to that 250, it's going to resist by making me more hungry and my metabolism goes down. But this is the magic. Metabolic system is reset after weight loss surgery. Weight loss surgery resets our metabolic system. We call it metabolic system calibration. So after you wake up, your body sees you at a lower set point. And as a result, you don't get as hungry and your metabolic system starts to burn fat. And so this is just all new findings when the researchers and scientists found that why weight loss surgery is so effective, right? Because it changes all the hormones that of course, it creates a restriction as well as hormonal changes. These hormonal changes happens naturally in the body after surgery. As you see the list on my right, this is just a list of known hormones that scientists just found out years ago. And the pharmaceutical went after simulating that by putting synthetic hormones. The first time was Ozempic. Of course, it had a different name, Novo Nordisk. I saw this in Obesity Week back in 2018 in Washington that they were advertising. So GLP-1 which we all know the name. GLP-1 was the first one. That is Ozempic. Now it's getting better. They added more of the naturally occurring hormones like GIP, and they're trying to basically simulate or emulate what the bariatric surgery does. But the problem is you have to keep taking it. We don't know what the long-term effect or side effects or risks are. We already know it affects vision. We already know it may create cancer in the thyroid. We already know it's not good for kidney and gallbladder. We already know um, it it causes muscle mass. And as far as practicality, we see that after the first year, 70% of people who take GLP-1 or GIP, I mean, basically the semaglutide medications, they stop. And ASMBS just released a study that shows weight loss surgery is 5 times more effective after 2 years. So we basically look at all the different solutions for weight loss in a pyramid like that. We're saying diet and exercise works. Yeah, if your BMI is low, if you have extensive exercise, yes, it's possible, but it's very small portion of population. The same thing with medications. And endoscopic procedure also have some, effect on certain people for certain population, but the gold standard is a sleeve bypass DS and all these new illegal procedures that Dr. Gutierrez is going to come. These are very interesting new procedures that it's being offered, and we are in the leading edge. We are offering all that is new to our patients to give them more and more options. Now, I know this is a very expensive procedure. First of all, there is a lot of equipment involved in the OR. There is a lot of medications, expensive medications involved in the OR and recovery. Well, I know in US they try to make this like an outpatient, like everything else, because the hospital, if you run a hospital by the code, is very expensive. And keeping you 2 nights in the hospital, it costs a lot of money. It does cost us a lot of money, but we don't cut corners. We keep you 2 nights in the hospital. And I mean, from my own experience, when they did my knee surgery, they were trying to make me walk in 1 hour. And they were trying to push me out of the surgery center. First of all, there's a difference between a surgery center and a hospital. Surgery center can only keep patients for 12 hours after surgery. It's not an overnight deal, but hospitals you can stay longer. And that's another thing you need to pay attention, where places you go, and we see a lot of advertised prices, even in the US, that they're cheap, but they're not doing this like they're supposed to. And medical tourism is what comes into picture when people go across the border to get either a procedure, for example, a stem cell. Stem cell is something we offer in Mexico that you cannot get in US. And the same thing with bariatric surgery. You go across the border to Mexico to get bariatric surgery because it's so affordable. And we do a good of a job or better job than what is offered in US or Canada or anywhere else. Um, there's so many benefits now. It's not just the price, um, is the expertise, the experience of these surgeons, the amount of these are dedicated surgeons, bariatric surgeons that are they have multiple certification. They're not only a um, general surgeon, they are specialized in bariatrics. They do this every day. If a surgeon is not in the OR, you need to question that because yes, they know how to do the procedure, but they're not practicing their skills are not going to be sharpened like the ones that are doing this every day. This is what I emphasize. They're doing surgery every day, and that's what they do. They don't worry about marketing. They don't worry about being on WhatsApp to talk to individual patients. They are doing surgery, and that's what counts. Okay. Dr. Gutierrez alone has more than 6,000 procedures performed, and he is so young. So, what kind of expertise are you getting? These are, you have to look at not just how much the package costs, because it's becoming all about price shopping. It should be about what is best for you. It's your body, it's your future, it's your life. MBC or Mexico Bariatric Center and Mexico Cosmetic Center are a US corporation. That's something else you need to pay attention. There are a lot of companies that they imitate MBC. We call them, they want to be MBC, but they're not the same. They're not a US corporation. They don't run their operation like we do. And I would explain all the details in a way. And you see that there, we are basically, NBC has been, in a way, regulating the industry because we set the standards and everyone else follows. We have over 13 years in the business. We've done close. This number still needs to be updated. We almost at the 30,000 bariatric surgery performed with top 5 bariatric surgeons. And these are not just numbers because I see a lot of companies, since we start putting these numbers up, they are trying to imitate and say, yeah, we've done so many surgeries, but do they really? We have our database to prove it. There's so many reasons you choose us. Our board certified, double board certified surgeons that are constantly attending IFSO, which is so there is an international congress for bariatric surgeons, and there is a local, the Mexican um, congress for bariatrics is getting so much traction now. And believe it or not, our surgeons are the one actually organizing it or lecturing in it or sending contributions or training other surgeons to do this. One of our surgeons was recently in Costa Rica training surgeons there. We get people, surgeons coming from South America, just getting trained by us. Look at our reviews. We have over 1,000 reviews on Google, and these are not fake reviews. And the hospital that we operate is a boutique hospital, is a private hospital. We will go over it. And because we have this team of surgeons, we manage their loads on a day-to-day basis. We don't give them too many surgeries in one day. I see that in US. There are surgeons that they only work a couple of days and they push all the surgeries into that one day. They do 9, 8, 9, 10 surgeries. I see it in Mexico too. So when the surgeon is doing the fifth and the sixth and the seventh and the eighth and the ninth and the 10th surgery, there's so much chance of making error. This is one of the reasons that our complication rates are so low. We are consistently below 1%. In US, 2.8% complication rate. 2.8 versus 0.05 or 0.07, which is less than 1%. You see, this is alone could be the one reason you choose MBC. Our surgeons are experienced. They're not just assistant surgeon. Dr. Gutierrez has a lot more than 6,000 surgeries, but we talk about 6,000 plus surgeries as a lead surgeon, not when he was in school and he was doing something else. This is how they advertise their numbers. I always compare uh, assistant surgeon that want to be a surgeon to an experienced surgeon. It's like a pilot with limited amount of flight times. Do you give your life to a pilot with less experience? No, because a lot of times nothing bad happens, but when the 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 occasion comes that you need to use your experience, that pilot, that surgeon doesn't have it. It will cost your life. Again, the social media is great, but it also comes with its drawback. What is this drawback? Is we don't know, you don't know who is behind all these cute Instagrams and TikTok. You can hire these um, independent contractors or freelancers to put out photoshopped photos, pictures, before after pictures. We don't know where they came from. They can make these cute TikTok quick short videos and make it look like they're doing a lot of work or they're doing a lot of good job, but we don't know what's behind that. What is behind these social media advertising on Facebook? Anybody can put up a Facebook and put these things on it. What is their credentials? Who is behind the company? Most of the time you don't know who the owner is. You just see one surgeon. And here's the deal. When you have a limited amount of surgeons, maybe one surgeon in a company, all they can do is what they can offer. Most of the time is gastric sleeve only or a bypass up to a certain BMI. But that's not fit everybody. I always say that. It's like trying to go shop for a jacket in a store and you go in and you're extra large. They have only up to medium, but they want to try to sell you that jacket. So what's going to happen is going to fit you the medium jacket and is not suitable for you. So you need an extra large. Remember that. That's why and Dr. Gutierrez is going to explain what all that we can offer, whether it's a revisional. I see surgeons that are advertising for revisional surgeries on AdWords, and they hardly can do a bypass. And then how would you even, how would it, this is honestly, that's what I'm saying. We are regulating the industry because we're setting standards. They're doing whatever to get business. And here's another reason you want to choose us. As you see, this is Hospital Azhar, and we've been operating for over a year now. The name actually come as a tribute to my mother, which passed away very shortly after the hospital opened. Um, and it has this is not just another hospital. This is a boutique private hospital. We don't have a lot of traffic from different companies, different surgeons. It's just our teamwork in the day to day. It's the same teamwork in the day to day. It's a state-of-the-art facility with state-of-the-art, um, all the OR equipment, all the OR facility, the sterilization facility, all that is state-of-the-art. And we have about 40 beds, and pretty much every room is a single bed, which means you get your private room. There are some options if you come with your buddy, but we basically have that available. And we have like in-house X-ray, in-house lab, in-house pharmacy. There is a lot to be said about the hospital, and patients have been very happy since we started coming here to the new hospital. Um, Again, talking about bringing your buddy. So we do actually have a special discount if you come with a family member or your friends. And our processes is very simple. We don't give you a runaround. You do the health questionnaire. Our surgeon actually received that, and you see how we distribute the health questionnaire is very interesting. We are actually ahead of the industry because after COVID, they started pushing what we call telehealth, right? Telehealth is when you actually do all these reviewing the patient's history online and doing all this paperwork online. We were doing this years ago. So we were ahead of this pack. And once you get your approval, you can actually book yourself by going online, pay the deposit, finding a date that fits you, and actually book your surgery. And then we complete your paperwork. You give us your flight information, or if you're driving, you finish your paperwork, you get your passport, all that paperwork, and we'll be good to go. So these are the packages we're offering. Again, we've never had this low prices with the top quality hospital you're getting, with top surgeons you're getting. So I would recommend that use this time to make a change because these packages are not going to last longer. Um, We have so many ways to support you before and after. One of the ways we support you is our Facebook groups. It's not just one group. There is a past patient group, which is over 13,000 patients. There are what we call inside Facebook group for the people who are just joining us, and so many different ones for different groups. Um, there are so many ways to reach us, right? So we have specifically slots for Surgeon Live, which is going to be on Facebook on Monday, Wednesday, Saturday. Wednesday, for sure. Sometimes if the surgeon is too busy, we skip Monday. And when we have webinar, we skip Saturday. So remember, 10 a.m. Pacific Standard Time is the surgeon Q&A. Coordinator Live, our coordinators go live bi-weekly from 3 to 4, again, Pacific Standard Time. Our nutritionists go live on a monthly basis, at least once or twice a month, 3 p.m. Pacific time, Standard Time. We even have Mental Health Live with Sarita every month, 3 p.m. Pacific Standard Time. You get notification for all these. Now, talking about support, of course, we have our administration, we have our marketing, we have our coordination, but this is a team of our past patients that are working with us day to day, supporting you. And I mean, look at the amount of expertise that is behind the company. Sarita Rina do a podcast every so often. And this is basically the exclusive network of best bariatric surgeons in Mexico. Dr. Miguel Montalvo, Alejandro Gutierrez, which is with us today, Dr. Rodriguez, Dr. Jackie Usuna, and Jesus Ceja. I was talking about telehealth, right? So when you submit your health questionnaire, we have complex algorithms that we have developed over years to know, based on your information, which surgeon is best for you. So we route your health questionnaire. Of course, if you are a gastric sleeve, BMI of 38, with no comorbidities problems, no heart problems, no high blood pressure problem, that's an easy choice. But not everyone has that profile. So we know which surgeon fits you the best, and we will route your questionnaire to that person, that surgeon. Our surgeon liaison is also a big factor in this whole process. She reviews every health questionnaire submitted that goes from our system back to the surgeon, back to you. As far as hotel stay or hospital stay, some patients, if you have room and you come by yourself, you have option to stay in the hospital the first night, or you can stay in Hyatt. Also, your companion has option to stay with you or stay in Hyatt. That's something you choose. Our pre-op diet is very simple. Is from 1 to 3 weeks, actually not from 1 week. So from 2-day clear liquid to 3 weeks. 2-day clear liquid is when your BMI is less than 35. And all it is you take lean protein and protein drinks, no sugar, well, cut down on your sugar and your starchy, and basically just lower your calorie a day. Pre-op diet is a huge part of this journey. When you start your journey, you need to be dedicated to it. You need to show that you can do it. You can do all the lifestyle changes, and it's a practice. And the better job you do, the easier is on the surgeon, easier on your body. If you're taking your medications on a regular basis, we would give you instructions what to do. Our surgeon liaison actually will do that with the doctor. But in general, stop blood thinners and NSAIDs 7 days. If you are on Ozempic type of medication, 3 weeks before. And no smoking before and after. That's huge. I see a lot of patients having problem with that. And bring bottles of prescriptions that you take regularly. We want you to arrive before noon and departure after 2 p.m., but 2 p.m. is ideal for your convenience. When you arrive, of course, we make you comfortable. We do all the pre-op tests. On the day of surgery, if you're in a hospital, no problem. If you're in a hotel, we pick you up, we take you there, we tell you what time to show up. You stay 2 nights, sometimes 3 nights, but most of the time 2 nights. And we are ready after the surgery, you're ready to go. You fly or drive home. If you have a long flight home, you can stay with us longer. Whether you stay with us in Tijuana, you can ask us to arrange for that, or you can stay in the San Diego side, whichever hotel you're comfortable. Hampton Inn is a great option. It's close to the airport, and um, has a special rate for our patients. If you mention NBC, they would give you discounted rooms. As far as flying in, Terminal 1, so there are two terminals in San Diego. Terminal 1 was under construction and it just went live. If you come with Southwest, you end up in Terminal 1. If you come with United, Delta, American, all those are in Terminal 2. Basically, pack light because the weather is not extreme. That's one of the pluses of Tijuana. Tijuana weather is like San Diego. It doesn't have extreme cold or hot. So pack light, and when you arrive, basically take your hopefully it's a carry-on, and walk out, tell the driver they call you the day before and you already connected with them, tell them which letter on the sidewalk you are, and they pick you up. It's as simple as that. Um, as far as post-op, the post-op diet consists of coming from a clear liquid to solid in 4 weeks. It's very important, again, to comply with all the pre-op and post-op diet. Our nutritionist would send you all that information. Again, you can reach out to her. She would text you, email you, call you if you need, and go over everything. So the first 2 years of post-op, what we call a honeymoon, and you keep losing weight. On average, after 1.5 years, these are the data that we collected from our past patients. Remember, you still lose weight up till 24 months, which is 2 years. So if you look at that, our gastric sleeve patients lose about 80 or more percent, which is higher than published data. Same thing with RMY, same thing with mini bypass, same thing with duodenal surgery. And why is that? This is where the expertise, skill, and experience of the surgeon comes into picture. Okay, so much I talked. I hope it was helpful, useful. Dr. Gutierrez, there's not much I have to talk about him. He's our chief surgeon. He's been with us for so many years, and he's a great doctor, great surgeon, great human being, very genuine. That's something else. You know, he's a genuine, caring doctor with so much skill, so much expertise. And again, he's one of the most wanted surgeons right now in Mexico. If you type best surgeons, he will come up because of his reviews, because of his skills, and he's going to let him take over. He could talk about himself, and the options we offer in our center. Thank you, Dr. Gutierrez.
Thanks, Ron. Thank everybody for being here with us, taking your time. Um, it's Today was very foggy in the morning, but right now the sun is come out, so it's a beautiful day. I already did two gastric sleeves today. Patients are in the rooms, very happy. Everything's doing fine. So, to talk about a little bit about the procedures that we do, we would first of all, we are always guided by IPSO and ASMBS, which is the worldwide and US associations for bariatric surgeons. So we always guide by what we found out. There are some procedures that are under revision, and sometimes we can do it as well, but always by hand of with them. So we can divide the procedures mostly in two aspects. We have the laparoscopic surgeries, and we have the endoscopic therapy. This is you can say brand new. Endoscopic therapy is for patients, mostly for two types of patients. Patients that are on the lower BMI range and they do not want to do like lose a lot of weight. So they can do it endoscopic. It's not a surgery. It's just an endoscopic procedure, slight sedation. Sometimes as an outpatient, depending on the procedure, and with good results. Obviously, not the same results as surgery, but it's for those kinds of patients. And another hand, patients that are like on a very high BMI, or they have some health condition that they cannot undergo a surgery. Um, they can do one of these procedures. They can lose a certain amount of weight, and with that, later on, their health improves as much as we can do the surgery later on. So we have all kinds of procedures since what do you know, gastric band that mostly we're taking bands out because we have better procedures right now. Gastric sleeve, gastric bypass, mini bypass, duodenal switch, SATIs, SACEs, conversions, revisions, reversals. So we can do all kinds of procedures that are IPSO guided. And the endoscopic therapy, we have the gastric balloon, obviously, that all of you know. We have the endoscopic sleeve hysterectomy, which is a newer procedure with very good results. And we have the Toray as well. This is mostly for patients that have room-wide procedures or mini gastric bypass. Okay, so we can go to the next slide. To talk about first, we have the gastric sleeve. Obviously, it's well known. It's the most common bariatric procedure done all around the world. You can say that it's a quick, not as much skillful surgery. What we do is that we're gonna go directly into the stomach and we're gonna remove like 70 to 80% of your actual stomach. It's an approximate. We're gonna leave a tiny portion of your stomach. So from the inner part, it says that it's like the width of your thumb. So very, very narrow, very tiny. You're gonna get full very fast. And second of all, that other portion of the stomach, we're gonna remove and we're gonna take it out of your body. So we were talking a little bit of hormones that we day by day we're getting to know more. In a part of the stomach, the fundus, the upper part that we're gonna take out, we know now that ghrelin, which is you could call it the hunger hormone, is produced mostly. So after removing this part of the stomach, your body's gonna produce much less ghrelin. So you're not gonna have those craving sensation, that binge eating. You're gonna have it much less. So this is an extra help. So those are the goals of the surgery. So this is a restricted procedure, obviously, because you get full very fast. You have to learn that we're going to give you all indications to separate liquids from solids, to eat slowly. There's a certain point that with all procedures that because you're learning how to eat the proper way back again, that you're going to eat like too fast or too much or certain types of food that could cause you a little bit of discomfort or even sometimes nausea and vomiting. So, but you learn how to take care of yourself. Okay, we can get to the next one. We have the sales. This is a single incision gastric sleeve, which is the on the inside is the same. It's a gastric sleeve, but the difference is in this case we take mostly care of aesthetics, and we do it with just one incision with a special equipment that we have, do it through the belly button. So it's mostly for aesthetic reasons. Obviously, to do this procedure, you have to fulfill certain criteria. So have to be on the lower BMI range. We have to see, we'll do a very good pre-op diet that we were talking about. Pre-op diet is mostly for two reasons: for your body to be prepared for surgery, inflammation to decrease. We've seen that patients, they do not have that much pain after, the bleeding tendency during surgery is decreased. And one very important is the liver shrinks in size. So it's not the same that we have to do surgery with a big liver on top of you doing surgery, that when the liver is smaller. So in this case, to do the seals, the liver has to be small, but the same results, same, only for aesthetic reasons. Okay. We can go to the next slide. Okay. Okay, the endoscopic procedure. So we have the ESG. The ESG, what we're gonna do is that it's an endoscopy. It's not a surgery. So we're gonna go with the endoscope as an upper GI endoscopy. Okay, normally. But the second step, we're just gonna check everything's fine. And the second step, we can attach on special equipment to the endoscope, so that lets us do stitches on the inside. So on the inside, we're gonna do some stitches to make the stomach smaller, mimicking. Okay, it's like a gastric plication, so it mimics the sleeve. So the same, you feel full or faster. You can you eat and do not have to that space to eat as much, and with good results. Obviously, the time and the percentage of the amount of weight that they're gonna lose is less than surgery, but it's an excellent choice since it's not a surgery, it's just an endoscopic treatment. Okay. We have the gastric bypass surgery. Well, the Roux-en-Y gastric bypass, this is very well known. At a certain point, they call it the gold standard. Nowadays, we have a lot of procedures, but most of the procedures combine what gastric sleeve and gastric bypass let us know about them. In gastric bypass, what we do is that two steps. We're gonna go first to the stomach. We're gonna cut the proximal portion. Okay, we call it the gastric pouch. Second step, we're gonna go to the intestines since the beginning. We're gonna count an average of sometimes 6, 8 feet, depending on the patient. It's not always the same. And what we do is that we cut the intestine down there. We take the distal limb. We're gonna bind and create an anastomosis, a communication with that pouch, with the stomach, and the other limb we bind into the same intestine. So what happens is that food, instead of going through the complete intestine, it bypasses that portion, that length of intestine. So and not going to be in touch with food, not going to be absorbing calories. But you have to be mentalized that it's not going to be absorbing calories, vitamins and minerals, sorry, as well, protein, all of that. So in any procedure, you have to do an extra help. Diet is very important, as we were talking about, but we have to give our body that extra help with vitamins and minerals. Obviously, it's not the same length when you do a gastric sleeve than when you do a bigger procedure. So but you have to be mentalized and doing some follow-up like now and then to do blood work and checking those vitamins minerals levels as well. So the Roux-en-Y is a malabsorptive, since we were talking about that portion not going to absorb calories. Very good results in losing weight and in metabolic effects. So all these procedures is like having Ozempic all the time. Ozempic and a lot of other hormones and enzymes in your body. So that the communication between your brain and your intestine is shifted to a healthier use. So that's why you see that your glucose level lower, your blood pressure. If you have sleep apnea, you don't have to use your CPAP machine anymore, and a lot of other conditions. they improve greatly. Okay. Okay, so there's a lot of questions. I was seeing your questions. There's always a question of what do I get, the sleeve or the bypass? Um, both of them are an excellent tool. We were talking. It's just a tool. You have to do the rest. Um, Obviously, the gastric bypass is a little bit more invasive, but with better long-term results. The gastric sleeve could be very well, but you have to do more maintenance in the future because if in the future you start to eating back again, or you eat slowly but you eat a lot, or you eat like liquid semi liquid carbs so you can regain the weight again. So both of them are very good, but obviously you have to keep in mind that of the difference of another one is that if patient previously they have a very bad acid reflux GERD, the best decision to do that the procedure is to do the Roux-en-Y gastric bypass. Roux-en-Y gastric bypass is considered an anti-reflux surgery. So with the sleeve, since the pressure inside that small stomach could increase, so reflux could persist or get worsened by time. So Roux-en-Y helps with acid reflux. Okay, we can. The mini gastric bypass is like a variant of the Roux-en-Y. Um, it started not long ago, like 15 years from now. It's mostly the same. We go to the stomach, we're gonna do the pouch a little bit longer, and we go to the intestine. Same, we measure the same length, but the difference is we do not cut the intestine down there. We're gonna take it as it is and bite it into that pouch, okay, in an omega loop fashion that we call. So it was called mini gastric bypass because of instead of doing two cuts to suturing to stapling is just one. So this lowers like 15 minutes of your peri time. That's why it's called mini. It's not that the surgery is a mini surgery. It should be called one anastomosis gastric bypass. We thought that we would have to wait like 10 years to see the results between Roux-en-Y and mini gastric bypass. Obviously, we got amazed because the results are the same in both of them. So this one has the advantage of it's just being one anastomosis, a little bit lowering the risk of bleeding and a leak after. So okay, we're gonna talk about it. Compare those. Okay. So obviously both of them are same results. Um, the only thing is that the same. If we have a acid reflux, GERD, Barrett's esophagus causing problems, the way to go is to do the Roux-en-Y gastric bypass. That's the best procedure. Actually, I had a patient during week. That patient 180, so we're gonna go and explain that. But she had a lot of acid reflux, so we discussed the case, and I told him that the best surgery for her would be to do the room wine. So we did that. Okay. Mhm. Okay, we're getting into more complex surgeries, but with the best results long term. We have the lentil switch surgery, and then we have some other variants, the SADIs, the SACEs, intestinal bipartition that we're gonna talk a little bit. In the lentil switch, this is a more invasive, more long surgery, but this one has the best results long term. This is for patients that are very big in BMI, or they need to get improve a heart condition, any health condition. So what we do is that we're gonna do a gastric sleeve first, okay, and then we're gonna go to the intestine. But instead of going to the from the beginning, we're gonna go at the end, okay, until the conjunction with the second with the um, colon. So we're gonna count like around it's 3 meters, it's 11, 12 feet, an approximate. And we cut the intestine down there. What we're gonna do is that the difference, we're gonna work on the duodenum. So we're gonna cut the duodenum and we're gonna create that anastomosis with the duodenum. So this has the advantage of having that ball. Okay, so It lowers the risk of a patient that can have a dumping syndrome, kind of like that. So it helps. And since you're gonna have just that 12 feet of intestine, so imagine the portion of calories being absorbed. You have to take care on this kind of procedures that take a very good diet. If you do not follow the diet and eat like too much fatty food, carbs, you can have diarrhea, like explosive diarrheas, kind of like that. So you just have to take care. And and the same on this type of surgeries, we always emphasize that you have to be taking vitamins and minerals and protein the rest of your life. So to prevent any problem with anemia and any other mineral. So just to be mentalized on that. Okay, you can. We have the SASI. SASI is a newer procedure. It's kind of like intestinal bipartition. What we do is that we're gonna do a gastric sleeve, the same, and then we're gonna go to intestine and measure that same length, like 12 feet. But with the difference, we're not go and work on the duodenum. We're gonna go and do an anastomosis. We're gonna bind the last portion of the stomach, the antrum, with that portion of the ileum of the intestine. So what's going to happen is that you're going to have the restrictive component of the sleep, and you're going to have like a bypass. But in this case, you have the two routes working. A portion of the food that you eat is going to go to the duodenum, to the complete intestine, and another portion is going to go directly into the last portion. So it's we're doing studies. It says that's going to go 70-30 or 60-40. We're working on that, but you have the results. The well, most of the food is going to go directly to the last portion, but the other portion is going to be absorbing vitamins, minerals, so an extra help with that. So very good results so far. And same as with the metabolic effect on this surgeries is the greatest. Okay, there's another one, a variant, the Sagi that we do like a sassy, if you call, but we're gonna do like another anastomosis in between the intestines. So all of this, some doctors from Brazil, they started doing a lot of bipartitions, and um, and they seen that they have very good results, and mostly, well, very good results on losing weight, but most of the metabolic effects are on these types of procedures. So working, creating a communication so that food goes into the last portion of the intestine to the ileum. So that spikes the production of GLP, GIP, PYY, all these incretins that helps us with our health. So the same, normally you can call it the duodenal switch, the as the Roux-en-Y, you can compare it, and the Sadie's as a mini gastric bypass. Both of them are the same procedure, but in one we do two anastomosis, and in the other we do just one. So same results, very good surgeries. Obviously, you have to take care on what we discussed, but very good results so far. So excellent surgeries. Okay, so you can see there's a lot of options, a lot of surgeries. Sometimes you can get confused. Um, but if you fill your health questionnaire, sometimes patient they put a one procedure. But when you're here, we're gonna go into your background before surgery, and we're gonna discuss everything and tell you what's the best surgery, the surgery that's tailored for you. Or sometimes we can do the options. We have this option and we have this option. Obviously, we let you decide. We just give you our recommendations, and we go by hand before and after surgery. So a lot of surgeries, so we're able to perform. Okay. We were talking about revision surgery. Revision surgery, it's considered when you already have gastrointestinal or a bariatric procedure that for several reasons, for most common is regaining of the weight or having acid reflux or any other one. So that patients they need like an extra help to convert it into another procedure. So we can do all kinds of prevention surgeries. Like we were talking about lap band, we're taking lap bands out, converting into a gastric bypass, a gastric sleeve, SATIs, different other procedures. The same goes with gastric sleeve. Some patients they regain weight, so we can convert it to any other procedure. So it helps. Obviously, we always tell in patients that revision surgery, the you're gonna lose weight, you're gonna do it, but it's a little bit slower at first. So just we tell them that follow indications and get there. So very good options that we have. We always talk a lot of hiatal hernia repairs, and you see it. Um, Hiatal hernia is a common. It's common in patients that are overweight. Up to 30% of patients they can have that. We have the diaphragm, the muscle that divides the thorax from the abdomen. It has some special openings to for structures to pass. One of in this case the esophagus. It has to have like a normal opening, like an inch size. But this is a weak spot. So when overweight creates a lot of intra-abdominal pressure, so that pressure goes into the weak spot, so that opening increases in size. So what happens is that the esophagus, like it's like a rubber band, if you may, pulls the stomach into the thorax, a part of it. So in this case, the stomach, that bulb that divides the esophagus from the stomach is not going to work properly. So the acid is going to come up all the way to the esophagus, food the same. So patients going to have acid reflux. None of all of them have, but most of the patients have. So whenever we do a bariatric surgery, mostly restricted, like gastric sleeve, we go and check if there's no hiatal hernia. And if it is, it's better to dissect it, to pull the stomach back to its place again, and to close that opening. So it's better because patient, if not later on, they will end up having acid reflux, endoscopy, surgery back again. So just to keep that in mind. Okay. Um, we were talking about diabetes, high blood pressure, sleep apnea, some type of cancers. Um, PCOS is very common and mostly in younger female patients. We've seen that fertility rate increases very greatly after surgery. And this is mostly because you lose weight and your communication with hormones, with enzymes is improved. So we have a lot of cases that patients had previously of PCOS, and we did the surgery, they lose the weight. We see patients that get pregnant once, twice, and we always get very happy. We always recommend for you, if you're planning on getting pregnant after, to wait a year. So this is for your body to adapt. Um, and normally this is the year that you're gonna lose the more of the weight, and then after you can get pregnant and be help and be mentalized that we need that extra help on vitamins and minerals, mostly on your pregnancy. Okay. Okay, we can, next slide. Very common question is how soon can I return to work? This is gonna depend on different factors, obviously on your health, previously, age, everything, and the other thing, the surgery that we did, and the type of work that you do. It's not the same if you do like a desk job that you're sitting, not lifting heavy things, or if it's different if you're moving around, walking a lot, pulling yourself up. So normally we recommend on general like 2 to 3 weeks. But this is gonna depend. If you have a desk job, normally we recommend 1 or 2 weeks. Some patients are a week after they're back and their job and doing it without any problem. We have some lifting restrictions. Normally, we recommend not to lift more than 15 pounds the first 3 weeks. no more than 30 pounds the first 2 months. So depending on those, sometimes we have to do 2 to 3, 2 to 4 weeks. One other thing that we have to keep in mind is that you're gonna be doing a pre-op diet. You're gonna be fasting the surgery. You're gonna continue on a special diet like around a month and a half, 2. So sometimes at first you're gonna feel low on energy. You're gonna feel weak. But this is just temporary. After, you're gonna regain that energy and you're gonna have double energy. So you just have to mentalize on this and return to work slowly. Have a bottle of water with you so you can be keeping hydrated. And that will be it. And start slowly. The same goes with exercise.
Well, thank you so much, Dr. Gutierrez, for taking time and going over briefly, at least, the procedures we offering. Again, the hospital Azar has given us the chance or potential giving you more services, um, cosmetic and plastic surgery. We work with board certified plastic surgeons that not only experience in plastic surgery, they're experienced in post-bariatric patients. Post-bariatric patients require certain skills that not every plastic surgeon has. And we offer a comprehensive list of, as you see, from facelift to tummy tuck. And then a mummy makeover basically is a catch-all term that covers multiple procedures in one operation. Usually is breast lift with or without augmentation implants with tummy tuck. And tummy tuck could be anything from a standard tummy tuck to a butterfly or circular. Arm lift is another one, or thigh lift is another popular procedure. And as I mentioned, we could do hybrid procedures like we've had, for example, umbilical hernia and hysterectomy together, or sleeve and hysterectomy together. So there's all this expertise we have now in the hospital. Endometriosis is a very hard to diagnose very inconvenient condition, and we could diagnose that with MRI mapping. There is no $995 fee for that, and we can do the procedure whether open or minimally invasive. A lot of people do have endometriosis, but they don't know it. So it's a very hard diagnosis, but we could do it with our expertise. As I mentioned, knee, hip replacement, and stem cell. Now we could do MSC stem cell treatment in our center, which is anti-aging applications, knee applications. Of course, this could be your spine, or if you have back problem, shoulder problem, this can take care of it. And there is numerous success stories, and we call full transformation. It's when patients come to us and they get bariatrics and plastics and change their lives and add years to their lives. Confidence is a game changing. One thing I want to mention is we don't do a high BMI plastic surgery because that's not recommended. So, for example, when Kelly came to us looking for plastic, we sent her to bariatric, and she got bariatric first and then plastic, and now she looks great. She's actually one of our affiliates working with us day to day. As far as financing, Well, the options you can pay us is pretty much we have a lot of options for you. Zelle is the no charge. Basically, it's we treat it like cash, or cash or cashier's check. Some occasions you can use FSA, depending on the card you have. You can get a loan against your 401k, personal loan, or get some a personal loan from SoFi or your bank. And we do have super money that we work with on our website. Well, there's again, you, make sure when you apply for a loan, though, don't apply to too many places. It would affect your credit score. There are some questions about MTI. Medical tourism insurance coverage is a huge plus with us because we have negotiated down this coverage for only $99. And as you see, these are the benefits you can get in case of complications. And is a huge, so this package itself can go up to $400 if you were to sign up for this individually. But going through our company, you get a discount of $99. Again, we mentioned about our nutritional program. We mentioned about Natalie. Bariatric vitamin is something else I need to go over because it's a must. And not taking multivitamin, just bariatric specific vitamins like Emerge. Unfortunately, we cannot ship it to outside of US because of the cost prohibitive. But you can get that shipped to you online by going to emergebariatrics.com or tell your coordinator. Okay, so one thing I haven't done, which I just going to do is to release the Zoom poll. Please make sure you fill that out. And we're gonna start answering questions now. So let's see what we got. I answered some already. The first one, Dr. Gutierrez, is in Spanish. Can you answer that one?
Oh yeah, let me. Okay,
Release.
yeah. Okay. Uh, okay, okay, okay. Arealis, thanks. Arealis had a gastric sleeve. What will be the best surgery for having success? Um, yeah, you can. We have some revisions. You can do in that case, we'll have to go on to your BMI. If you have acid reflux, the thing to do it will be a gastric bypass. If you have a big BMI, well, we can do a SADIs, we can do a little switch. And or if you don't have a acid reflux, we can do a mini gastric bypass as well. So there's a lot of options. We can when you're here or by phone, we can go each one and what will be the best for you since your background. So we have some options.
Perla is asking, what experience do you have with patients who do not accept blood transfusions?
Okay, well, yeah, it's not uncommon. We have patients that they do not accept. Fortunately, when we need blood transfusion, it's very rare. Still, we have to take all measures. We have special medications to help you coagulate. We take all measures before and during surgery. So yeah, it's not uncommon. We can still perform the surgery. And yeah, no problem.
Shelby is asking, I'm a 41-year-old female, 300 pounds, 5'4", which is translates to BMI of 48. Would you recommend sleeve or mini bypass for long-lasting results?
Okay, if you're looking for long term, well, the mini bypass compared to the sleep will be better. Um, in your case. So yeah, both of them could be good, but the sleeve you will have to do more maintenance, take more care. If you say like for long lasting, well, the mini bypass, the bypass will be better, but both of them, depending on how you take care, it will be gonna be good.
She's also asking, what's the difference in vitamins between two procedures? I work in a very busy medical office,
Okay,
and
yeah, well, okay, sorry. So yeah,
yeah, just the vitamin. What's the difference between vitamins for sleeve versus bypass?
yeah, well, first of all, have to do a very good diet. Diet means that you take all vitamins and minerals from food, but you're gonna add an extra help since we're gonna be cutting a portion of the stomach, bypassing the intestines, so it's not they're not gonna be absorbing the same as well. So it's obviously it's more the malabsorptive, the bypass. You will need more time and taking more vitamins and minerals than the sleep. The sleep is just the stomach, part of the stomach. So normally we recommend 1 or 2 years, depending if you're eating properly. And with the bypass, we recommend a little bit more. But this is going to depend on each patient if they need an extra help or they eating properly. So.
Um, Again, I answered this question already. So when you submit your health questionnaire, please make sure that you put all the information, relevant information in there and do as complete as a job as you can. Based on that, the surgeon is going to review, they're going to make a recommendation, and you get scheduled for that type of surgery. When you go down to Mexico, you actually get a consultation pre-op operation, which means you're gonna have, let's say you are scheduled with Dr. Gutierrez. You get to talk to him again, go over everything, make sure it's a solid plan, and then you go through the surgery with that plan. Now, if you change your mind or you talk to the surgeon and something pops that you want to get a different surgery, by all means, you get that type of surgery. We just switch you. If it was more expensive, you pay. If it was less expensive, we will put you on the refund list and we refund you. So there's, yeah, and then you start your pre-op again based on your BMI, whether it's from 2 weeks or 1 week or 2 days. You get that done. The day you arrive, you're still going to be on pre-op on the clear liquid though, yeah? Okay, so we already went over MTI. And the question is, what happens if you have complications? So, Dr. Gutierrez, you may want to talk about the short-term risk of complication, long-term risk of complication, and we go from there.
Yes, of course. Yeah, well, there's always when you have surgery that you could have complications, minor or major, or you can have acute or chronic complications. Um, Fortunately, we have very few rate of complications. Still, we recommend that you take all precautions, that you follow all measures. Um, Acute complications, most fear are bleeding, as in any surgery, and a leak. So that's why you stay a couple of days here in the hospital. So that's where it's most common, and we're taking care of it. So as you get discharged, we recommend for you to follow the diet, to not to leave heavy things, all of those things that in most of the cases the complication arises is because patients do not follow the rules, the what we recommend. And there's chronic complications. If you're already home and you have like a major complication, a serious complication, so the recommended thing is, since it's serious, that you go to your nearest hospital. Um, well, sometimes it's a minor complication. Where we're gonna be always be talking by phone. We're gonna do a follow up, and sometimes patients, and even with when you go into a hospital, we're talking with the surgeons back home, back when you are, and yeah, sometimes doctors say that if you do a surgery outside US, they're not gonna help you, not gonna give you treatment. But if it's a complication, if it's a serious one, they have to give you the care. So you go to your nearest hospital, and we continue by phone doing a follow up with you.
Something I see a lot of questions about mini sleeve. Usually we do talk about mini sleeve, but maybe you want to mention what is mini sleeve and what's the difference between sleeve and a mini sleeve? Who can benefit from that?
Yeah, yeah, of course. Yeah, mini sleeve was a term. It's not a proper term that associations are I say. That's why sometimes you're not gonna find it. Mini sleeve is that when patients say, "I do not want to do like a full gastric sleeve. Do not want to take like 70 to 85% of my stomach out. I want to eat a little bit more. Don't want to lose that much weight." So in those cases, we can take less of your stomach, and that's why it's called a mini sleeve. Um, Obviously, we let the patients know that since it's not gonna be taking the complete stomach out, as with the gastric sleeve, the results we cannot say that's gonna be the same. Maybe you can lose less, or you can regain faster. So, but some patients they have low BMIs. They say I want to do that, and we can do it as well. So that's mostly the mini sleeve.
What is dumping syndrome?
Okay, dumping syndrome. It's when when in this case, when we create a communication between the stomach and intestine, we do not have a valve, okay, between those two. So food gets into the intestine pre-digested from the stomach, even from the mouth. So when you eat like too fast, or eat a lot of carbs, a lot of protein, and it goes directly into the intestine doesn't know how to digest that. So it starts to liberate a lot of hormones, a lot of enzymes that cause you, even without any type of surgery, all of us, when we ate too fast or a lot of food, you start feeling bad, cramps, bloatiness. You start to feel sweatiness. Your heartbeat increases. You have vomiting, diarrhea, or sometimes even faint. So that's a dumping syndrome. And so you have to be taking care of what you eat slowly. Not all patients they have that, and even with the sleep you can have that, and even without any surgery. So it's just taking care of what you eat, follow indications, and to prevent that from happening.
Now patients are asking for revision from sleeve to bypass. Is that a good option if they had bad GERD? Um, is that a good option?
Yeah, yeah, it's actually is the most common option. Since you had a restricted procedure and now you want to move into a malabsorptive procedure, and even more if you have acid reflux, since we were telling that sometimes patients after the sleep could have acid reflux. So yeah, the thing to do will be the Roux-en-Y gastric bypass. to help you to lose more weight and help with the GERD, with reflux.
Can you explain why we ask them not to smoke before and after, at least a month before and a month after?
Yes, sure. Yeah, that's a common question. And not only in bariatric surgery, but in all kind of surgeries, when you smoke, your oxygen levels are decreased. Red blood cells carries less oxygen. So in order to heal properly, we need oxygen to heal. So if the oxygen levels are decreased, your healing process is not going to be as effective. So you can have complications. So that's why we recommend patients to decrease or stop smoking a month or even more if they can. The same happens with marijuana or vaping. With marijuana, we've seen that the risk of bleeding increases. Your coagulation is impaired. So that's why we recommend, and the same, the oxygen level. So we recommend to follow that indication. So it's for your health, it's for you to not have complications.
Okay, so we still have 67 open questions. Some actually we already answered. And we are getting to almost 1 hour, 45 minutes. Um, so again, if you guys didn't hear the question you have answered, please circle back with us. You can call our office, you can talk to your coordinator. Every patient gets assigned to a dedicated coordinator, so you don't have to explain your case every time. So go ahead and ask us your questions. Please, again, you get a chance to go online. We have Wednesday, 10 a.m. Pacific Standard Time that you can have a chance to ask the surgeon again the questions we have. You have. Again, so many ways to reach out to us. Um, so I'm going to announce the winner. It's Magnolia Everett. Magnolia Everett. I will let you open up so you can unmute yourself and talk to us. Magnolia Everett.
Oh, hello.
Hi, congratulations.
Oh, thank you.
You're
I'm,
welcome. So tell us about yourself.
yeah, so I'm a working mom. I work from home for an insurance company. I have four beautiful boys. I have 22, 15, 6, and 4. Um, I've been researching into weight loss surgeries for so long, and I've been looking into this probably about 6 years actually. So I am just super excited to have this chance to be able to get the surgery.
Yeah, that's great. And not only you get this life-changing surgery, you get a discounted life-changing surgery. And where are you coming from? What city? What state?
Yeah, so I'm in Knoxville, Tennessee.
Tennessee. Wow, we get a lot in Tennessee. Yeah, we should probably get a trip to Tennessee. I see a lot of patients from there. So, okay, well, thank you so much for everybody to attend. Magnolia, congratulations again. Dr. Gutierrez, we appreciate you. Thank you for all that you do for patients, for us, and taking time to go over the stuff. I hope this was a useful presentation. And I know some people get impatient about the length of this, but believe me, all these questions that we see, we need to be detailed so people can actually hear their concerns, hear you know what the questions they have answered. But again, we always here for you. If you need anything, get back to us. Okay, thank you again. Thank you, Dr. Gutierrez. We'll see you soon. Goodbye.